This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
Let me ask you a question. Has this ever happened to you? You're going about your day, everything is fine and dandy, all is good, and then suddenly the vision in one of your eyes starts changing. It's blurry and you see these squiggly lines or maybe some flashes. That can be a scary experience if it's never happened to you before.
Oh, absolutely. Your mind starts going to some really dark places. Am I having a stroke? Do I have a brain tumor?
Yes.
Then it goes away and your eyes are back to normal. Well, there is a good chance that you just had an ocular or ophthalmic migraine. And as we find out from Dr. Todd Bescak of Chesapeake Eye Center, it's probably nothing to worry about. Dr. Todd Bescak of Chesapeake Eye Center says he hears it all the time.
It's a very common call that I get after hours on the weekends.
It usually doesn't take long for Dr. Bescak to figure out what's going on, an ocular or ophthalmic migraine.
I prefer ophthalmic. It's also called a retinal migraine to some.
Although it may seem like a terrifying experience, Dr. Bescak says it's a pretty common condition.
The statistics say that about 25% of the people suffer from one of these at some point in their life.
But what they see may vary.
You can see flashing lights. You can see sort of metamorphopsia, which is like bending of images. Like when you're looking at a grill and you see things waving over it, you can have that sort of phenomenon.
How long it lasts is how Dr. Bescak confirms what it is.
It only lasts less than an hour, almost always. The average is about 5 minutes to 20 minutes. But during that 5 to 20 minutes, when you're going through this, it can be, obviously quite distressing, especially when you're going through it for the first time.
Dr. Bescak says muscle spasms within arteries of the eyes create the visual aura, and like muscle spasms in other parts of the body, they don't last long.
They get tired and they give out and things kind of return to normal.
As for what triggers the spasms, Dr. Bescak says it could be a host of things.
The big ones are stress, increased caffeine, and not enough sleep. Those are the top three. It's also been associated with drinking of red wine, certain foods like chocolates, but the big three are like I mentioned, stress, caffeine, lack of sleep.
Dr. Bescak says there's no indication as to why some people get ophthalmic migraines and some don't.
We do see that it's more common in women, and it's more common in your 30s and 40s and 50s.
Although Dr. Bescak can diagnose an ophthalmic migraine based on symptoms, he still recommends a follow-up visit to the office.
Absolutely, because these sort of symptoms are similar to things like retinal detachment, similar to things like a stroke or a transient ischemic attack. So those things are obviously very dangerous and do need to be checked out. But typically from the history that I'm even getting on the phone or if I'm speaking to someone in person, I can kind of put the pieces together that that's what it is.
As for treatment, Dr. Bescak says it all depends on the frequency of the migraines.
If it's something that happens maybe once or twice a year, there's not really anything we're going to do for it. I'm not going to put you on a preventative medication for something that may come once a summer. But if it's happening 1, 2, 3 times a week, there are some medicines that you can be put on, like a beta blocker, calcium channel blocker. There's actually some antidepressants that people take to keep them from coming around.
Otherwise, he advises his patients to recognize when an ophthalmic migraine is coming on and plan the duration appropriately.
And typically whatever you have is what you're always going to have, and whatever I have is what I'm always going to have. So if I'm seeing like that temporary loss of right-sided vision, I know that I'm going through this right now. I kind of take a break, sit down, lay down if I can. If if you happen to be driving, pull over for a bit, wait for it to pass, and move on.
Dr. Bescak adds that some people actually get a headache with an ophthalmic migraine, but that's not typical. I, for one, I do get these, by the way, and I do get the headache with them sometimes.
Does one come before the other or about the same time?
About the same time, and
Really?
I'll just take something for the headache just to make sure it doesn't get
Just
too
to stop
bad or
there.
it doesn't stick around.
How about that?
Yeah.
Wow.